Okay, so Chapter 7, Endocrine and Miscellaneous. This video will cover alpha adrenergic blockers and BPH. BPH stands for benign prostatic hyperplasia, and it is a disease typically seen in older men that leads to prostate growth, which then in turn leads to difficulty with urination. So these are the 4 medications we'll be discussing in this video. 3 of the medications are considered alpha blockers. So alpha is a receptor in the sympathetic nervous system, and typically when it is agonized, it works to constrict smooth muscle in the bladder, neck, and prostate capsule, which causes retention of urine. So if we block that, then we'll relax those 2 muscles, and then that will lead to easier urine outflow. So the non-selective alpha blocker is Doxazosin or Cardura. So since it is non-selective, since it will also work in the bladder, neck, and prostate capsule, it also works in the periphery and it causes vasodilation in blood vessels, which can then also lead to low blood pressure. There are 2 selective alpha blockers that we'll be discussing today, Tamsulosin or Flomax, and Alfuzosin or Urexatrol, and those are selective for the alpha receptors in the prostate and the bladder. So we can remember that they're specific for the bladder because Flomax, it looks like max urine flow, and the Alfuzosin, the Urexatrol, you can think of that as urine control. The other medication we'll be discussing today is dutasteride or Avodart, and that is a 5-alpha reductase inhibitor. 5-alpha reductase is an enzyme that works to convert testosterone to DHT, the active form of testosterone in the prostate. When we block the 5-alpha reductase, then we have less conversion of testosterone to its active form, which then decreases the obstruction of the urethra by the prostate. So then it will then shrink the prostate and lead to easier voiding of urine. So the steroid stem of dutasteride looks like steroid, which can then remind you that it's for men and kind of its mechanism of action. Okay, so now we'll go through a couple of practice questions about these medications. So practice question 1, a selective alpha blocker that can cause abnormal ejaculation is... And so the answers for the next couple questions will remain the same. So A will be Doxazosin, B will be Tamsulosin, C will be Alfuzosin, and D will be dutasteride. So the correct answer is B, Tamsulosin. So A, Doxazosin is incorrect because it is a non-selective alpha blocker. And then while Alfuzosin is a selective alpha blocker, it actually doesn't have the ejaculatory issues that Tamsulosin has. So it can be a good option if men are concerned about that side effect. And then dutasteride has a completely different mechanism of action, and it is a 5-alpha reductase inhibitor. So now we'll change the question to make each of the other answers correct. So question 3, make A correct. An alpha blocker that can be used to treat hypertension is, and so the correct answer is A, Doxazosin. While B and C are both alpha blockers, they have no effect on blood pressure since they are selective for muscles in the bladder, so those are incorrect. And then dutasteride is not an alpha blocker and it does not affect blood pressure. So like we discussed before, the Doxazosin is non-selective, so it also causes vasodilation in the blood vessels, so that can lower blood pressure. So this can also cause some of the side effects that we see with it, which is orthostatic hypotension, which is low blood pressure when moving from a laying to sitting or sitting to standing position. And the Doxazosin also has a high risk of first dose syncope, which is just passing out after you take the first dose of it since your body's not used to it. Question 4, make C correct. A selective alpha blocker that has a risk of drug interactions is... So A, Doxazosin is incorrect because it is a non-selective alpha blocker. Tamsulosin, while it is a selective alpha blocker, there's not very many drug interactions that we're concerned about. And then D, dutasteride, is incorrect because it is not an alpha blocker. So the alfuzosin, it's metabolized by the CYP enzymes in the liver, and so that can lead to a higher risk of drug interactions. So if a patient's on quite a few medications that could possibly interact, this might not be a very good choice. Question 5, make D correct. A drug indicated for BPH that works by reducing prostate size is, so the correct answer is D, dutasteride. Doxazosin, Tamsulosin, and alfuzosin all work to relax urinary smooth muscles, and then doxazosin has that other effect of vasodilation of vessels. And then remember that the dutasteride looks like steroid, so it's used in men, and it inhibits 5-alpha reductase, which converts testosterone to its active form, DHT.